since how many years are you practicing this fertility related, ma'am?
So I'm practicing in fertility since almost now 11 years, 10 years, more than 10 years.
Like how many cases you might have make them positive, ma'am?
Okay, so it must be in thousands now, because like you can consider almost a year around, we will see like 600-700 patients. So all those patients who turn into IVF, they will have all these procedures done. So you can say more than 6-7 thousand.
Okay, what's the positive percentage, ma'am, like in IVF?
So IVF actually, this started long time ago, 45 years ago, with the birth of Louis Brown. So that time, like the scientists Edward and Steptoe, who actually developed this technology, and they got first time this live born baby. So for that they had to put decades of their effort, first to how to take out the eggs, how to stimulate the ovaries, how to make the embryo, then how to transfer it, and then continuation of pregnancy. So if you consider, like they had done some 300 transfers for one pregnancy to get implanted, and then the Louis Brown, when she was born, it was like a miracle. So this happened 45 years ago. Louis Brown herself, then now she is 45 years, she has 2 children of her own which she conceived naturally. So that time it was very tough, but over all these 45 years there are many advances in IVF. Like now the drugs which have improved. Previously there used to be menopausal gonadotropins, which are extracted from urine of the patients and which is processed in the pharmaceutical companies. Those gonadotropins were available. Now we have recombinant drugs which are more safe, which have less side effects. Then also different protocols. Initially very few protocols were there. Then as we learned which patients benefit from which drugs, then the protocols also evolved, also to reduce the complications of IVF. So now if you see, newer drugs, safer drugs, less complications. Treatment can be customized to different patients. So some PCOD patients will require a different protocol, different drugs. Some patient who has very less egg reserve, very less number of eggs, will require different medications, different protocol. Also somebody who has normal number of eggs, normal reserve, that will require different protocol. So all these advancements have basically increased the safety of the procedure, reduce the complications, and mainly increase the success rate. So if you see now around 60% you can say the IVF success rate is. So which was until few years ago, like maybe around 9 to 10 years ago, was somewhere around 30 to 40%. So now it has improved to 60%, which is a good news for patients. Also now patients are aware. Like till few years ago, patients were not aware. The availability of treatment was not there everywhere. Only like major cities, metro cities had centers for the IVF. So it was difficult for patients traveling. Then again the cost of staying in a different city, along with the cost of treatment. So when it was available at less number of hospitals, the cost was also higher. So now these treatments are available at many places. So cost has reduced, safety has improved, success rate has improved.